Roxbury, sponsored by City Councilor Matt O'Malley. My name is Michelle Wu. I chair the committee, and my role is to remind everyone that this public hearing is being recorded and broadcast on Comcast Channel 8 and RCN Channel 82. And if you would, please silence your cell phones, etc. We will hear from councilors who wish to give an opening statement, then from the applicants before us, and then open it up for questions. After that, we will take public testimony, so if anyone wishes to testify, please check the box on the sign-in sheets. So I'll just hand it over to the sponsor of this and the District City Councilor, Matt O'Malley.
Thank you, Madam Chair, and thank you, Councillor Flynn, as well, for joining us this afternoon. I look forward to our spirited discussion with Beacon Compassions. I just wanted to offer a couple of thoughts on my perspective of how we got to this process for those that are watching at home. It was a little better than a year ago. Beacon Compassions came to my office and expressed interest of opening a proposed medical marijuana dispensary on VFW Parkway in West Roxbury, close to the Dedham border. I had two requests at that time. One, that they conduct as robust a community process as has been seen, meeting with every neighborhood association, civic group that is affected by this proposed facility, as well as the Boston Trailer Park, 1515 VFW Parkway, Boston's only trailer park, which I am proud to represent, is directly across the street from this proposed location. That was the first ask. The second ask is that this dispensary be a medicinal marijuana dispensary only. As many of us know, recreational marijuana will soon be legal in the Commonwealth, and in order for my support of this, we need to make sure that it is medicinal only, and there is some language that will be used in a proviso. It's been used on two dispensaries so far, one on Newbury Street and one on Milk Street. Both of went through this process of a council hearing before ZBA, and both agreed to be, the language reads, proviso at the ZBA, the treatment center is limited to medicinal marijuana or medical marijuana use only. They have agreed to that proviso. They've also conducted a very robust community process, which I know they're going to get into a little more specifics. As a result of that community process, with meetings, the West Roxbury Neighborhood Council, West Roxbury Civic and Improvement Association, the Charles River Spring Valley Association, as well as the Trailer Park Association, all four entities have either written letters or offered their non-opposition to this facility, again, provided that it is medical only. So we're joined today by Rita Cometti, who is the President and CEO of Beacon Compassion Center, and Steve Angelo, the Executive Director of Beacon Compassion Center. I know I have some questions, but wanted to offer you two an opportunity to just get into some opening remarks. Thank you.
All for allowing us to present today. My name is Rena Cometti. I'm the president of Beacon Compassion Center, and I'm excited to share Beacon's plan to what we believe would be one of the best medical marijuana facilities in the state. Our proposed location is 1524 VFW Parkway in West Roxbury, just around the corner from the Veterans Administration Hospital near the Dedham line. I would like to take a few minutes to give you an overview of Beacon Compassion. I'm proud to say that we are one of the only few groups in the industry that is a female-led organization. We are here this evening to ask the City Council for a letter of support or non-opposition to allow us to move forward with the Zoning Board of Appeals and the Department of Public Health to become licensed. We have met with the West Roxbury Neighborhood Council, received a letter of support. We have also received letters of non-opposition from the West Roxbury Civic Association, Charles River Spring Valley Association, and 1550 VFW Parkway Trailer Park Association, as Councilor O'Malley had said. We had also a great meeting with the West Roxbury Main Street Director, even though that location is outside their geographic territory on the VFW Parkway. We also have spoken with the VA hospital, who cannot formally support us because of federal laws, but they understand that this medicine being available in walking distance to the VA will be helpful to our veterans. Every group we were asked by Councilor O'Malley to engage have stated that they do not oppose us moving forward. The mission of Beacon is to create an atmosphere that promotes total wellness in a warm, friendly, patient-focused environment. Qualified registered patients will be able to safely and conveniently access both medical-grade cannabis and educational materials. The staff will treat each patient with respect while guiding them through the process. We will partner with the community through donations to local charities, community events, and nonprofits. Beacon will observe and whenever possible, exceed all state and local regulations. Beacon has also committed to helping the elderly residents who may not have the means to purchase this medicine when those situations are brought to our attention. To give a little background on myself, I live in Walpole, Massachusetts. I've been a real estate appraiser for about 25 years and own a successful appraisal management company that covers 20 states. I've been a native of Massachusetts my entire life and have always lived about 15 to 30 minutes from West Roxbury. I was born in Hyde Park. My family, including grandparents and aunts and uncles, all lived there for many years. Over 25 years ago, I purchased a home in Reedville, and my daughter was born there as well. The city of Boston is very dear to my heart and has always been my home, so it is important to me, as I am sure it is to you, that the group that would have the honor to be located in West Roxbury would have the respect and love for this community. Because my partner and I live in a short distance of this proposed facility, we have given all of our personal information, including cell phone numbers, to the residents we met with, as well as Councilor O'Malley, so you can be assured that we will be personally responsive to any issues that are brought to our attention. With me this afternoon is Steve Angelo. Steve is our Executive Director. His background is in IT technology and compliance. He's also the founder of a software company in the real estate industry. Steve has spent many years working for NSTAR, where he is responsible for IT security and governance programs. Also part of our team is Doug Rhodes. Doug started his career as a chef working in fine dining after receiving a degree in food science. Doug went on to leadership roles, bringing his commitment to healthy living and organization excellence with him. He decided to further his passion for health education by becoming a registered nurse. Doug will be one of the RNs that will hold a position as patient services managers to educate patients and staff on the health benefits of cannabis. We put together also an outstanding board of directors. They include Bob LaBelle, legendary sportscaster who you invited into your living room for decades. Bob is a medical marijuana patient and is hoping to shine a spotlight on the need to open dispensaries to help patients in Massachusetts. Also on our board is Dr. Edgar Belanis, a physician who works closely with patients in treatment and recovering from addiction. Jana Mitzberg, a licensed pharmacist who managed a pharmacy in Hyde Park. Tony Civittoni, another medical marijuana patient who was raised in Rosendale and West Roxbury as his children attended Holy Name School. Stephen O'Reilly, a former state trooper with decades of experience overseeing several drug units. And rounding our board of directors is Tracy Quigg. She is a licensed clinical social worker. We're extremely proud of our team who bring together decades of business, healthcare, and patient experience. Each of our board members and the rest of our organization all live in Massachusetts, and we were born here. Most are born here, and this is our home. We have partnered with other experts in the medical marijuana industry to ensure the highest standards of operations. With decades of experience in business management, law enforcement, medical and pharmaceutical services, we have the skills and the commitment necessary to ensure a well-run, well-managed registered marijuana dispensary. Our well-run, women-led team is respected and has been frequently recognized for their contributions in their industries. We decided to get into the medical marijuana industry for both personal and professional reasons. We, as I'm sure many of you, have lost loved ones to disease. We believe passionately that if medical marijuana had been legal at the time, it could have helped ease their pain and suffering. We are passionate and excited to bring this medicine to the residents of West Roxbury. As you know, back in 2012, Massachusetts voted to approve the medical marijuana program through a ballot initiative, and over 60% of the residents in the Commonwealth voted in favor for providing medical marijuana to patients. Presently, the Department of Public Health oversees the medical marijuana program in Massachusetts, and some of the conditions that medical marijuana has been approved for are hepatitis, AIDS, MS, Parkinson's, glaucoma, cancers, and others that are determined by a patient's doctor. With regards to the package, you'll notice there is no reference to adult use or legalization for adults over 21. This is because we are a medically focused organization and our mission is to help patients in need. We are presenting this afternoon for a medical marijuana facility only, as other dispensaries have in Boston that the Zoning Board of Appeals has approved as medical marijuana only. I'd like to give you an update of where we are in the process. We participated back in the 2013-2014 licensing process, and we received the 4th highest score of all of the 181 applicants. We also participated in an application process in the town of Framingham, now the city of Framingham, with 5 other groups. We were the highest scored group and the only group to receive a unanimous vote of support from the selectmen. We presently hold a provisional license in Framingham and also in New Bedford, where we also received a unanimous vote of support as well. It is important to note that at our dispensary locations, all dispensaries must receive a recommendation from a doctor and register with the Department of Public Health. Medical marijuana cards are issued to patients after the information is verified. The card is barcoded and similar to a driver's license. When patients come to this dispensary, they will first need to show their patient ID and license to the security card via camera. They would then enter into a man trap, and their information is checked against DPH's online monitoring system. Once confirmed, then they are allowed into the dispensary. Beacon Compassion is committed to the safety of patients, employees, and the public. We will be implementing a state-of-the-art security system at our facility, which includes on-site security guards, 24/7 video surveillance of both inside and outside the facility, biometric and/or keycard access controls, security zones within the facility to ensure only those that are required access are allowed to enter, and multiple panic alarms that will be directly wired into the West Roxbury Police Department. We will discuss our security plans with the West Roxbury Police Department in greater detail once we move through the process to ensure the highest level of neighborhood security. Additionally, Stephen O'Reilly, a member of our board of directors, will serve as Director of Security. Stephen has over 40 years of combined experience operating surveillance equipment, employing security measures, and set up alarms and access control systems. The location of our proposed dispensary is 1524 VFW Parkway. We have obtained a lease that includes 5,000 square feet in the lower level. This is a preferred location within the West Roxbury neighborhood, as it is far away from sensitive uses such as parks, schools, churches, etc. And as stated above, it is readily accessible for VA patients. The signage will be nondescript, so the average citizen will not even know that it's there. The location has ample parking with easy, safe access for patients, and patients are not permitted to consume products on the property. We are not proposing to do any patient deliveries out of the facility. This decreases the chances for issues to arise with bulk product exiting the facility. All products entering the facility will be pre-weighed, packaged, and sealed. This will help and ensure that there are no unwanted odors that linger outside the facility, and we will ensure that we can meet patient demand via decreased patient transaction times. We will not package or produce any edible product that is marketed or attracted to children ever. We will ensure that our educational and intake programs are geared towards the first-time or novice user. We will be stocking the facility and utilizing a just-in-time delivery method, which will ensure that there is not an abundance of product in the facility at any given time. This will further decrease the attractiveness of this facility from any potential crime activity. We will utilize a back shelf concept behind the point of sale stations, and then this will assure that there's no product in the patient access area of the facility. I'd like to talk a little bit about community involvement, and Beacon is committed to being part of the community it serves, and we work hard to engage the community in a number of ways, including sponsoring local health-based events, as well as participating in non-paid community events. Beacon feels strongly about giving back to the community and will support local charities, nonprofit agencies, or programs of the community's choice. Upon approval by the Boston City Council, we will proceed with our dispensary, and we will begin to schedule a series of community events educated towards educating the West Roxbury residents, as well as contacting feedback from them as well. Beacon will hire approximately 15 to 20 permanent full and part-time jobs with preference to West Roxbury residents and veterans. The facility will be properly staffed and designed to allow for patients to be assisted in an efficient manner, minimizing issues surrounding parking lot or long wait times. In addition to the direct hiring, We will work in good faith, legal, and non-discriminatory manner to hire local vendors, suppliers, contractors, and builders from the area wherever possible. Beacon, as referenced above, will have a robust financial hardship program for patients in need that cannot afford to purchase medicine at retail prices. Our program ensures no patient is without medicine for financial reasons. Also, Beacon will commit to being Beacon will commit to be active financially in community-based youth and sports organizations and any other initiatives like open space improvements that will take its lead from the counselor and the leaders in the neighborhood in contributing to the way that is in respect to the entire neighborhood. Thank you for your time, and I'd like to ask for a vote of non-opposition or a letter of support, and we'd be happy to answer any questions. Thank you.
Thank you very much for the detailed information. I have just two short questions before I hand it over to my colleagues. So you had mentioned provisional licenses elsewhere. Will you be operating multiple locations at once?
Yes, we'll have.
Are you moving forward with all of them?
Correct, 3 licenses.
Okay. And are the others in New Bedford and Framingham already up and running?
They are not at this time.
Okay.
We have the provisional licenses. We're in the process of getting our cultivation up and running, going through architectural review, et cetera. So that's the first piece of it. Once that's done, and while that's being done, then we can work on our retail facilities and get them up and running.
And at this location, how many customers or patients do you anticipate coming through on a daily or monthly basis?
We anticipate probably about 100 patients a day, maybe 150 patients a day.
Okay. Great.
And also to the, as we spoke to in the regards to the pre-packaging, we're hoping that the wait time when patients come into the facility would significantly be decreased because of that method of dispensing the medicine.
Great, thank you. Councilor O'Malley?
Thank you, Madam Chair, and thank you, Rena and Steve, for that thorough overview. Right off the bat, do you agree right now that we will, should this go through the council before ZBA, there will be a proviso at the Zoning Board of Appeals which reads, the treatment center is limited to medical marijuana use only?
Absolutely.
Absolutely.
Great. Okay, that's glad to hear, and I appreciate that. Talk a little bit more about the security. Will you you mentioned a director of security who will be a full-time staffer. Will you be working with Boston Police for details? Can you talk a little bit about that?
Yeah, essentially in the very beginning, we will take advantage of the police detail, just so that we reckon, for the flow of traffic, et cetera. We will utilize their services in the beginning. Ongoing, we'll most likely will be doing as needed, but we will have full-time on-site security guards at all times.
For all hours of operation?
Correct.
And what are the hours of operation proposed to be?
They're going to be approximately from 10 a.m. to 7 p.m. with probably lesser hours on Sundays, probably till 5 or 6 o'clock.
Okay, so 7 days a week, reduced schedule on Sundays.
Sundays, correct.
But about 10 to 7
Correct.
per day.
Yeah, we really don't have any desire to be open much later than that.
Yeah, and where is your cultivation facility?
We are working through the process through the city of Attleboro at this
Okay.
time.
And so that I know these things take a lot of time.
Yes,
So provided that we go forward in Framingham and New Bedford, there'll be a cultivation center in Attleboro or North Attleboro, and then that will feed the 3.
Correct.
And will the stock be delivered, I assume, before the clinic is open or before the dispensary is open?
Probably right before.
Okay.
Exactly.
It's a later start, okay. And the signage will be nondescript?
Nondescript.
So it'll look something probably similar to that, a logo, Beacon Compassion?
Exactly, yeah.
Sign it,
And
okay.
actually, the state has regulations for signage as well.
Okay, that's great. 15 to 20 full and part-time employees. Well, and talk about sort of the medical experience. I know you've talked a little bit about the medical professionals who will be on staff.
If I could interject,
Please, Steve.
we do have Doug Rhodes, who is our patient services manager and RN. If there are specific questions, we'd love to have him come
Sure.
down and answer those if you'd like.
Sure. Hi, Mr. Rhodes. Thank you, please. So talk a little bit about your experience as an RN and the medical, will there be a doctor on site, for example?
There will not be a doctor on site. Of course, everyone before they're allowed into their building has to see a doctor to get the recommendation.
Okay. And there'll be nurses on site other than yourself?
Yeah, so all of our locations will be staffed with a nurse for all of the hours that are opened. And one of the things that we want to be able to do is create cannabis care plans for the patients who come in to make sure that, they're treating it and taking a medical approach to it. You'd never go to your doctor and have them send you home with like a bottle of Valium. Here, try this, see what works for you. That wouldn't really be medically sound. So we don't want to send people home without them being thoroughly educated as far as what they have, what to expect.
Okay, that's great. And any other sort of clinicians or social workers, or is there, talk a little bit about the type of employees that you need at a dispensary. So you need someone with medical background, someone with business background. Can you talk any of, or all of you?
Well, our board of directors is made up of pharmacists, doctors, and
Yep.
social workers, because we really are taking the medical approach. So as a team, we've come up with the way we're going to do patient interaction, and we're really focusing on it being a little different than the industry standard. It really will be a fully medical approach.
So just staffed at, if I could add to that, staffed at the retail facilities themselves will be a patient services manager, the front-end patient services staff, inventory control and security personnel primarily at the retail centers. And there will be, additional levels of individuals that float around between the facilities, but from a day-to-day staffing perspective, it's mostly the front-end facing security and inventory control at the retail centers. And so, yes, there's a social worker as part of the board as well, and to bring all of this together, and the programs and the education is really the mark that we're going for here to bring a service and not just a product.
No, I appreciate that. And this is almost an entirely cash business because of sort of federal conflicting guidelines, correct?
Yeah, yes and no. So every dispensary in operations today in the state of Massachusetts, and I believe there's 18 or 19 now at this point, all take debit cards. And so
Okay.
debit transactions are the norm. We look at the data to see if, where the percentage comes in, but a significant percentage does come in. That's not to suggest there's not a cash issue itself. And our plan would be to get cash. And just as we had described earlier on the just-in-time delivery method, right? We don't want to have a month's worth of product sitting in the facility for no reason, right? So just with that, we wouldn't have, all this cash sitting there either. And so that cash would be getting out of the facility just as quickly as we'd be delivering product into the facility for a just-in-time sale perspective. So there would not be
Like
large quantities.
Wells Fargo or some bank or whomever that will pick it up and deliver it,
Absolutely.
armored truck, safety, and
Correct.
Okay.
Absolutely.
And Medicare doesn't pay it.
No
So-
insurance pays for this, correct?
So no insurance. So when you talk specifically about outreach to veterans and seniors, and I appreciate that, that was another ask that we had made, talk about ways that you can sort of, you mention sort of a sliding scale for those in need to provide?
Yeah, like hardship programs.
Okay, and how will that work?
We're working through the details now, but essentially it would be discounted medicine for certain individuals that would qualify that.
They're based on the
qualify for
level of need, and we have different staggered pricing based on the level of need.
Okay, I think this is, and then talk about the man trap or the Sally Port. I walk in, and then, so just walk us through
Yep.
what it
So
takes to get in.
actually, before you even are buzzed into the building,
Yeah.
there is an exterior camera that is the security guard is viewing. So you need to show your patient ID at the camera. Security guard buzzes you in. You come into a man trap, into an area. At that point is where you would give your license and your patient ID. The security guard then takes that information and validates it with DPH's online monitoring system. So right then and there, you will know if they are truly a patient, and if they do qualify for additional medicine. So if they've gone to another dispensary, because there's limits on the amount of that you can purchase. So that's all being tracked. So if they come into our dispensary and they've already gone above their allowance, so to speak, that the department has given them, they would not be able to even enter the dispensary at that point. So once the information is verified, then they are then buzzed in again into the dispensary, and then they will be, have paperwork to fill out if it's the first time that they're there, meet with a consultant, for lack of a better term at this point, but someone that if they need to sit down with someone, that those options would be available to them, especially for novice users. We want to make sure that anyone that is getting into this medicine for the first time is very well educated and understands all parts of it, and we want them to walk away feeling really comfortable with what they have just chosen, the path that they've chosen to go down.
Great, thank you. And then, this is a busy road, a state highway, 4-lane, Parkway Highway. And I do think that you've got a great length to make sure that it was not close to a school or park or playground. There is a children's center, where kids, neglecting the name right now, but
Like
I
an
know.
indoor playground.
Indoor playground.
Yeah.
That is relatively close. What's it called?
Yeah.
Michelle's been there with her little guys.
Kids stop and leave.
What is the
Yeah.
distance from that to your dispensary?
It's over 500 feet.
Yeah.
We actually, just to confirm, we had a surveyor go out to the property and measure the facility to that, and it's in the packet there. It's over 500
Over
500 feet. Yes,
Thank you. And
yes.
that's been independent surveyor.
Oh, absolutely,
Provided
yes.
the
Yep.
documentation for that. All right, and do appreciate your commitment to being a good neighbor and supporting the great neighborhood and the great city of Boston. So that is all I have at this time right now, Madam Chair. Thank you.
Thank you. Counselor Flynn.
Thank you, Madam Chair. The community process is critical on this debate, and I'm going to follow the debate closely over the weeks and months ahead, because I know this issue will impact every district across the city, specifically what role the community and neighborhood organizations will play in the process. And I'm also going to hopefully study lessons learned as this debate continues throughout our city. I want to be sure, and I know our city council colleagues share this view as well, with the rollout that the neighborhood process is respected and that impacted neighborhoods have a voice. And I just have one question. Can you talk a little about the interaction you had with the VA medical staff on this issue?
I believe, I think that was Paul, right?
Yeah, that was, one of the other team members had engaged the VA hospital. I don't have the exact specifics, but I can certainly get those to you. But one of our team members had engaged the VA. It wasn't us directly personally, so rather than convey an exact representation, I can't do that personally.
And did the VA weigh in one way or another on if they were in support or not in support or no opinion?
They essentially said that they would not oppose us, but they couldn't give us a support just because of the federal issues related to cannabis. So they couldn't officially come out and just say, yes, we support you, but they have stated that they would not oppose us. We know that there's many veterans that use cannabis, so and they're aware of it as well too, and I think that their hands are tied, to some degree when it comes to this, but they did speak that they would not oppose us.
Thank you.
You're welcome.
Thank you, Counselor Flynn. Counselor Baker.
Good morning.
Good morning.
Or afternoon, whatever it is. Thank you for coming in. Rena, can you tell me how you got into the medical business, medical marijuana business? Like, what got you here? You were in real estate and...
Yeah, essentially, again, back in 2012, voted in favor of it. And when the law passed, just kind of took that as a, wow, I'm a true believer in this. And then as we started just researching it and getting more and more involved in it, as far as understanding what this drug actually does and what the medicine and how helpful it could be, we started meeting with some patient advocacy groups and started hearing their stories on how this medicine has helped them. And after meeting and then recognizing that, that this medicine has truly helped people live a better life and better quality of life, essentially is what this is all about. And as we just started to get more information on it, we just personally became more passionate about it and wanted to become involved in it. So we started looking into what that would take and, met with, we're waiting for the regulations to come out, and we said, well, first of all, we need to see what that looks like. And then when the regulations did come out, and because they were so robust, we decided that we wanted to be a part of it. And we like the fact that it's very regulated. We don't want gray areas. We want it to be black and white. We want to tell us what to do, and we will follow the rules. If the regulations weren't so robust, we may not have entered into this, but as things were going, we found ourselves finally going, how do we not get involved in this? And
Yeah.
then and
So
things
when you
started
say
happening
we,
from
are
there.
you talking about?
Essentially, my partner and I, Steve Angelo, were the founders of it.
Oh, okay. And I just want to commend Counselor O'Malley for just being open to this, because I do believe, I'm a believer also. I've had people in my life that have benefited,
Absolutely.
I believe, from that. And I think the business needs an opportunity to take a foothold in the city. And with Counselor O'Malley stepping up, we have one more that will come. I think we need to get across the city and let the business, let the people of the city see what the business is going to do for a year or 2 or 3 years. So thank you on that, Counselor O'Malley. Rena, you talked about you scored high on when it was statewide, and then you scored very high in Framingham. And what made your scores so high? Like, what was your package? What separated your package from the rest of the other proponents?
I think it's just our team in general, in regards to our board of directors, just our passion, our professionalism with this as well, too. I think we're so passionate about this, and we want to bring this medicine and be a part of it in Massachusetts. It seemed like there was just no other path once we got so involved in this.
Yeah. And you don't think that in 3 years or 4 years with the pull of recreational that, and you see people across the city, you're really doing a lot of business in the recreational space, you don't think that you're going to need to go to that, or?
That's something I think we'd have to probably address at the time.
Okay.
But that's.
But for right now, you're signing on the
medical
dotted line,
marijuana
says
only.
you don't plan on going down there.
Correct.
Okay, and educating West Roxbury residents on the benefits of marijuana, or just educating on what are we going to educate the West Roxbury residents on?
All of the above, but I'll have Doug speak to that.
So prior to coming to Beacon, I worked for Signature Healthcare, where my sole job was to get our 3,000 employees to be healthier. So in doing that, I ran, learn how to meditate, lose weight programs, how to quit smoking. So my background is really in health promotion and education. And that's exactly how I want to approach cannabis education to the public. A lot of people, there's not a lot of good information out there. If you Google it, you're probably going to get poor information. So the community really does need people who are actually educated and have medical backgrounds to be able to discuss it with them so they can make an intelligent choice with their, primary care provider if it is something they want to try and it's going to be right for them. So there's a lot of educational opportunities for us. So prior to opening and after we're opened, we're going to want to have education sessions basically for the public to be able to come. We won't be able to hold those sessions within the dispensary because you need to have the dispensary card prior to being
enter,
admitted. Yeah. But there's a lot of other locations, like the Elks Club, where we went to one of the public meetings, libraries, where we can have open educational meetings so people who want to come find out a little bit more about it. If they have any direct questions they want to answer, they can actually talk to myself or somebody else with a healthcare background who will be able to give them good guidance.
Good, and you met with a number of groups and got non-opposition across the board.
Correct.
Yeah.
Yes.
That's good. Cannabis care plan. You come up with the cannabis care plan,
Yeah, so
Doug, and will you kind of lay that out for me? What is that? What is?
Sure. Well, nursing itself is based on a nursing care plan. So you want to figure out, when you have a patient, what is the goal? What is the actual outcome you're looking for? That's the first thing you establish. And then you establish, well, what do we need to do to get from here to that goal? And how are we going to monitor it to see, are we actually getting from where we started to the goal through the means we want? So you can go back and look at it later and say, okay, it made the person feel better, but we didn't get to the goal we wanted. Do we have to do something else? Do we want to reevaluate? So by having a actual care plan, it's like a roadmap for how to interact with it. I wouldn't want to send a patient home with, here's something you've never tried before,
Yeah.
you don't know how strong it is, you don't know what to anticipate, and what are you actually trying to accomplish?
So let me ask you a question, like someone with Crohn's
Yeah.
is gonna operate and want something different from someone that has cancer.
Yeah, and that's a great example. So, Crohn's is really a matter of inflammation. So CBD has been clinically shown to reduce inflammation. So for someone like that, you may want to suggest or recommend that they try a higher CBD product. It doesn't have the psychoactive effects. It won't get the high feeling from it. However, it'll help with
So
inflammation.
CBDs and THCs, what we're talking about, the CBDs are good for the tinctures and those sorts of things?
So either one of those, molecules can be used either way. They both have distinct medical advantages. So when you're working with patients, you want to really try to guide them towards not only the kind of molecular combination that's likely to work for them, but also the delivery method. An example would be someone who takes an edible product that may affect, that might take 2 hours to affect them, and they may still feel it 6 hours later. That may not be in accordance with the goal of what they're looking for. If they're looking for something that's going to help them sleep all the way through the night, that may be perfect because it's going to be a slow release dose. It's going to get them through the night. It's going to get them what they actually want.
Yeah.
If they're looking to do something, first thing in the morning because they have a lot of stiffness and arthritis pain, that may be a poor choice because it may, hinder their activities for the rest of the day.
All right, good. Can you, and maybe along that same lines, can you talk a little bit, the correlation between marijuana used as pain medication as opposed to the opioids? And can you speak at all about maybe someone that is a former opioid user? Would marijuana or cannabis be helpful for that person?
Yeah, so they found terrific benefit in that. In California, they're actually starting to open some recovery centers for people to get off of opioids who are using cannabinoids as part of their official program.
As edibles or smoking the flower?
And that's going to be somewhat case-specific on the place. Most organizations will not use flower because flower has a certain amount of variance, as well as smoking is just not, putting smoke into your lungs is not going to be a great health idea. So either vaporization, edibles, it could be tinctures, patches, depending upon what the outcome, what the duration of time, how fast you'd like the effect to start, when you'd like the effect to kind of be over.
And you just mentioned vaporization. What's the difference between the vape and the regular smoke?
All right, so vaporization, it's compare it to like steam. So if you had, the plant material and I lit it on fire, I'm not only burning the active compounds, but I'm also burning plant material. Cellulose material, chlorophyll, everything else. Those don't necessarily have medical properties. And again, smoking, you're putting, small particles into your lungs, probably not a great idea. There's enough evidence to show that smoking is not necessarily the best method of ingestion. So with vaporization, you're heating up the chemical components until they more or less turn to steam or vapor, and then you're breathing those in. So you're not getting, you're not actually combusting anything, you're not burning plant material, you're not getting any small particles in your lungs. So
But isn't there is some effect on the lungs, though, wouldn't it be?
With vaporization, there has not been any study that I'm aware of that shows a negative impact of vaporization. With like e-cigarettes, nicotine ones, there are, but it's not because of the delivery method, it's because of the additives and other things they're adding into it chemically.
Yeah. One of the things I think about a lot is how are we going to get that, or when it does happen, when are we going to get that non-traditional patient, the grandmother that might be 70 years old now and has, been anti for her whole life, and then maybe someone like you will be able to show her a different medication, her or him, whatever, and it'll be interesting to see the way this plays out in the next couple of years. And man trap, can that be a woman trap, or should it be a gender non-specific trap?
We can call it a vestibule. It's probably the better, you're right.
Thank you, and good luck.
You're welcome. Thank you.
Thank you, Councilor Baker. Do you want to Councilor O'Malley?
Just to be clear, because Rena, you had talked about this, and Doug, you talked about edibles as well. There will be no gummies or edibles geared towards children.
That are attracted to
Absolutely not.
children? Absolutely not.
Right.
Absolutely not.
Okay. What do you see, or what have you heard? What typically, how do patients in some of the up-and-running dispensaries receive their medical marijuana? Is it vapor, is it?
All forms, I mean, the flower, the vaporization,
Yeah.
the edibles, the tinctures, where the people, again, to what Doug had said earlier, it's truly every patient may have a different way that they would
Sure.
like to have the delivery, and each one of them affects the patient differently. And each patient is different, too. So it's not like a Tylenol that you say, take every 4 hours, and call me in the morning. It's, these are the goals. What do you want to happen? How is it that you want, what is the right thing for you? And it's pretty much going to be an individual basis.
Okay, that is great. And the city council law is you cannot have more than one marijuana dispensary within half a mile of another. That is correct?
That's
your
correct.
understanding? Yeah.
Yes.
And that's so. I have letters here which we'll make sure our colleagues get from a number of the neighborhood associations that you referenced that say letter of non-opposition provided it is medicinal only, which you have agreed this will be medicinal only, and that will be written in an ironclad amendment to the zoning, or proviso, I should say, to the zoning. So thank you all. I have no further
Thank you.
questions,
Okay.
Madam Chair.
Thank you, Councilor O'Malley. We had no one signed up on the sheet to testify, but at this time, is there anyone in the chamber who wants to offer some public comment? Okay, then I really appreciate your time. We will take this up at the next council meeting in consultation with the sponsor. And again, thank you for appearing before the council. This concludes our hearing on docket 0168, order for a hearing regarding a medical marijuana dispensary at 1524 VFW Parkway in West Roxbury. The hearing is adjourned.
Thank you.
Thank you.
Thank you.
Thanks.